I'm Sarah Baldassaro. I am with Plaza Women's Health, and we are new to the HCA family. I knew from a young age that I wanted to be a doctor. I just didn't know exactly what type. I knew I wanted to help people, but also to be involved in new innovations in healthcare in general. I specifically decided to do ObGyn because I like the combination of being able to follow patients all across the lifespan, but also I really enjoy the hands-on aspects of ObGyn. So I love the surgeries, I love the procedures. There's something new going on every day and every minute. I get to help people build families. I get to help people make sexual health decisions. I get to help people decide how they're going to enter into menopause and how I can help them transition with that. I'm on labor and delivery some days. I'm in the clinic some days. And so it's a sort of lifelong discussion and really a lifelong kind of bond that you get to build with patients. So I try to look at a patient from the point of view of, what's going on with them psychosocially, what's going on with them with their physical and mental health, as well as what's going on in their family, their workplace. What sorts of things do we need to focus on so that I can be the one that thinks about their health and they can move on with thinking about other important parts of their life. In general, our first interaction with a new mom or new pregnancy is that we see them at around 8 to 10 weeks of gestation in the office. The reason we see them at that point, even though it seems late for a lot of people because they know they're pregnant at 4 or 5 weeks a lot of times, is because that's the point where we can get a good ultrasound in the office and confirm that everything's going okay or address any issues if they are present. And then is about counseling. So how to take care of the pregnancy, genetic testing and screening options, how to best prepare for parenthood and the journey of pregnancy, because before you become a parent, you've got 9 to 10 months of creating a being. And so guiding patients through that is really what our first visit is about. I see patients from adolescence all the way until the end of their life, and that I get to help coordinate their care all the way through their entire lifespan. We see patients who run the gamut from very low risk to very high risk pregnancies. In the case of a high risk pregnancy, we interact with and consult with our high risk obstetric physicians so that we can provide our patients with the best care but still keep as much of their care within our office so the patient feels like they have a medical home throughout their pregnancy.